Welcome to the Tech Blog Writer Podcast, your guide to future tech trends and innovation in a language you understand. Now, over to your host, Neil Hughes.
Welcome back to the Tech Blog Writer Podcast. Now, I gave you all the greatest gift I could offer any of you at this time of year, which of course is a rest from my voice for a few days. Because sending out a podcast every day of the week is time consuming for me, but I also have enough self-awareness to know that you probably have other things going on and other things that you want to listen to. So bombarding your feeds with 7 episodes a week means that you might fall behind. Plus, if I'm completely honest with you, after a crazily busy week of editing my own show, my clients' episodes, and writing over 20 articles, I was overcome with a feeling to, just take my foot off the gas and do absolutely nothing. So my weekend consisted of dog walking, binge watching Sinner Season 2 on Netflix and playing video games. But most importantly of all, I tried to get that Baby Shark song earworm out of my head once and for all. I don't know if you've seen Halloween 3, but I'm sure that Baby Shark song is on the same lines. But I digress. Let me know what you got up to at the weekend. I'd love to hear more about what you all do and where you listen to the show. So remember, you can always email me, techblogwriter@outlook.com, or send me a cheeky tweet at Neil C. Hughes. Now, as we head towards Web 3.0, I'm predictably getting many, many more guests around the emerging technologies, such as blockchain and the Internet of Things, voice search, and so much more. But as crypto investors will tell you, this space is quite volatile at the moment, and the first questions I usually want to ask when interviewing anyone around a blockchain company is, what problems are you actually going to solve? And why blockchain? And what about the partnerships? Because without real-world adoption, it doesn't matter how great any technology is or any tech-based solution is. So today, I want to try mixing things up a little bit. Yes, I have a healthcare-focused blockchain company that's developing the world's first interoperability health data standard for decentralized apps and smart contracts. But rather than just dive in and get him on here and ask about the partnerships, ask about the adoption, I asked them to bring on one of their partners on the show today, and they're the good guys at Good Shepherd Pharmacy. What's the worst that could happen? So buckle up and hold on tight as I beam your ears all the way to Tennessee so we can speak with Phil Baker from the Good Shepherd Pharmacy and Stuart Lackey, co-founder and CEO at Solaster. So a massive warm welcome to the show, guys. Can you tell the listeners a little about who you are and what you do?
Sure, I'll go first. My name is Stuart Lackey. I'm the co-founder and CEO of Solaster. And what Solaster is really the idea born out of a collaboration and essentially a whiteboard exercise, Neil, where our co-founders and a trusted team of advisors gathered about a year and a half ago here in Nashville, Tennessee. And quickly, for those that do not know, Nashville is kind of the center and mecca of healthcare services in the United States. There's over 450 healthcare direct companies and then an additional 400 agencies and kind of providers and suppliers as a result of that. So while we're probably most famously known as the Music City for our entertainment, actually the healthcare industry produces a significant amount of more revenue and jobs than entertainment, almost at a 4-to-1 ratio. So side fun fact there. But essentially, our team got together and all of us experienced in healthcare and have participated at different levels. Some of us as providers, some of us as entrepreneurs, some of us as administrators, and had a really cathartic experience as to try to identify what's wrong with healthcare. And around that same time, blockchain technology kind of started to gain some traction, and we contemplated what a more decentralized, patient-centric health experience might look like, not just in the U.S., but globally, because the technology affords us to be able to consider that, perhaps for the first time. And so Solaster was born out of that initial conversation and then through a collaboration of, again, healthcare advisors and partners, all who see the vision and the benefits of a more patient-centric health ecosystem in reality.
I'm Phil Baker. I'm a pharmacist in Memphis, Tennessee, about 3 hours from Nashville. And 3 years ago, I opened a nonprofit charity pharmacy to serve low-income uninsured people with free medications. That quickly grew into a membership model pharmacy where we don't accept insurance or any of the corrupt pricing practices associated with it. Our members pay a flat monthly fee and get all of their prescriptions at cost or below. And so over the course of 3 years, we've grown our pharmacy to 1,000 monthly subscribers. And this was moving into a project where we're going to be the first program in the country where any individual can donate their unused oral chemotherapy medications. These are prescriptions that cost upwards of $30,000 to $60,000 per month. They can donate those unused meds to our program, and we'll be able to redispense them to low-income uninsured patients who would not otherwise have been able to afford them. And so in gearing up, it took 2 years of work with the state of Tennessee to get the law changed to even enable the program. Looking at gearing up to start that program around October of this year, which we did successfully launch in late October, I started learning about blockchain. And I'm not a technical guy. I'm a pharmacist, and I'm not even a very handy person for that matter. But blockchain just really made sense to me in that it enables price transparency. It will enable the patients to own their own data, monetize that data. From a chain of custody perspective, it obviously makes a lot of sense. And I thought, wow, this would be a really great use case. This specifically just reclaiming these chemotherapy high value medications using a blockchain system to reestablish chain of custody. And then ultimately we want to track that all the way down to the actual health outcomes that are resulted when we recycle these meds and give them to patients who wouldn't otherwise be able to afford them. Blockchain just sets the stage to do all of that. And so in June of this year, I connected with Kevin Clausen, who's a professor at the College of Pharmacy at Lipscomb University, who's also a blockchain expert. He's a mutual friend between Stuart and I, and he connected us and learned that Solaster, to my knowledge, had the first healthcare protocol, first one that I'd seen that really made sense, that's going to enable healthcare organizations to basically talk to each other on a blockchain system. And so very quickly realized that that was something we wanted to incorporate, and jumped on board to partner with Solaster to build out this first use case.
And you're both on an incredibly exciting journey at the moment, and we'll talk about how you're both leveraging technology for the greater good in just a few moments. But first of all, I've just got to pick up on your point, Stuart, how Nashville's much more than a music city, because I was there earlier this year, and it really, really is going through a big transformational moment, isn't it, right now? Because straight away I could see that there was so much going on. There's cranes everywhere. There's a big startup scene. There is so much more to it, isn't there now?
Without question, there's healthcare's always been a big part of the local and regional economy here in Middle Tennessee. HCA was founded back in the 60s. The HCA stands for Hospital Corporation of America, Neil. It's the largest hospital network in the country, one of the largest in the world. And so that has set the stage over the last 4 or 5 decades for many healthcare companies to be spun off or acquired. And really just a lot of innovation has happened as a result of HCA's foresight and vision several decades ago. And so that needs to be stated. But yes, I mean, there are, again, over 400 healthcare companies of all sizes that are based here. And there's a collective energy that this city has in terms of trying to solve, really hard, complex issues. And so you see some of the best minds in the country. And we're fortunate enough that a lot of people, even from Silicon Valley and some of the kind of the brightest markets and institutions in the country now call Nashville home as they seek to innovate and make improvements on healthcare. So we're very blessed in that sense. And again, just tons of growth here in this part of the state, and healthcare is a big part of it.
And Stuart, I think I first heard about you when I spoke with Marcus Whitney way back on episode 584. But for anyone that did miss that episode, what's your relationship with him, and how did you meet, and what role does he have?
So Marcus and I met years ago, Neil, introduced by a mutual friend who's also in kind of the healthcare startup world, and watched each other's career kind of from afar. I worked for most recently in the surgical device startup realm for a company called Trans One, which was a novel surgical solution for 5-1 lumbar fusion. And then secondly, most recently, was with a company called SI Bone based out of San Jose, California. Did a variety of functions, but most notably, and most from a rewarding standpoint, helped build out their commercialization of a product called iFuse. And SI Bone just did a $124 million IPO about a month ago. So a lot of heavy sweat equity by a group of people that I was very fortunate to work with throughout that both of those companies to do some amazing things. But we had been working or watching each other, like I said, and then around that time, Marcus and I and others were part of that original collaboration to say, okay, healthcare is broken. It's a $4 trillion spend in the U.S., give or take. It's not sustainable. How can we fix it? And so he and I got pretty fired up about, the possibilities of blockchain and, kind of an unencumbered solution. And so what happened, Marcus is co-founder of an organization called Briovation, and Briovation has a couple of funds that they use to kind of seed and help grow early stage healthcare startups. They have over 60 companies in their portfolio now. Solaster was their first blockchain investment and became a major kind of component of their business model. So he and I saw kind of how healthcare needed to be changed, and again sought to do that. And so we stood Solaster up. He plays a kind of a key role as an advisor as well. And so he and I have worked very closely on this project together.
So for people just tuning in and hearing about Solaster for the very first time, it is a leading healthcare-focused blockchain company that's developing the world's first interoperability health data standard for decentralized apps and smart contracts. But can you just offer a bit of an overview of exactly what it is and the kind of problems that you're solving?
Absolutely. So one of the things that Marcus and I, quickly looked at was what's happening right now in the blockchain world. And I hate using that word so generally, but as we looked at the decentralized projects and companies that were being built, Neil, we saw over 200 plus projects that were out there. Most of them were being built on Ethereum, but very few of them were talking to one another. And so currently in healthcare, and this is not just exclusive to the US, but in other developed countries, you have kind of this problem of data silos, right? Where in the U.S., as a result and an unintended consequence of the Affordable Care Act, you had companies like Cerner, Epic, and thousands others that are electronic medical records platforms that capitalized, the digitization, if you will, digitalization of healthcare records, right? And so suddenly it was an open market, which is great. But the problem is now it's very challenging if you're a patient, let's say at Kaiser on the West Coast in the U.S., and you're in Miami, Florida, and need to seek care at a facility there that's an HCA hospital. It's very, very unlikely that your data is going to be easily portable, even with all the technology that we have. And so what we wanted to do and what we're trying to do at Solaster is, and realize the opportunity, we need a standard data architecture, right? So in this new world of decentralized applications and decentralization of healthcare, we need a standard data architecture. And so we realized that there was nothing out there like that. We want all these applications to be very successful, but also have the ability for them to transfer and transmit patient data where appropriate and when appropriate. And so we launched and started the creation of an effort called Go70. And essentially Go70 is a data standard based on HL7 FHIR, which is a health data standard in the kind of the traditional healthcare world. And so we are doing that in collaboration with Vanderbilt University, who's doing some really interesting things on the blockchain front. So working with the data scientists at Vanderbilt to build out what we're calling Go70 as a working name. So very excited about it. We think it solves a real issue, a potential issue that's going to, that would otherwise cause a lot of friction and pain points in a new decentralized health reality, if that makes sense.
And if we do have any techies listening, Solaster is built on GoChain, 100% Ethereum compatible blockchain, which is actually 100 times faster. and more distributed and greener than Ethereum. And this Go70 standard will allow application developers to build the global healthcare network of the future. But can you tell me a little bit more about your vision and the opportunities that blockchain is providing that have actually been unthinkable until right now?
Yeah, so I mean, if you think about, again, I'm not a statistician, I'm not a data scientist, but I am kind of blown away by some of the statistical realities, right? And Phil touched on a few of these a minute ago, but I think we definitely need to spend more time on them. So let me give you a couple of statistics, Neil. In 1960, in the U.S., out-of-pocket payment for physician and clinical services was around 60%, meaning as patients, as consumers, and I'll use those two words interchangeably in this example, we paid 60% of all those costs out of pocket. We paid 96% of all prescription drug costs out of pocket. Okay, think about that. Wow. Moving forward in 2016, we pay 23% out of pocket for physician and clinical services, and we only pay 14% for our prescription drug costs. Now, some people may hear those stats and go, yay, healthcare's working famously. We're saving people so much money. Well, actually, the opposite is true. What's happened over time is, and this is why we're so excited about Good Shepherd, is that the insurance industry over several decades has become a tremendous friction point and intermediary in healthcare, right? While it may be great that you're part of a plan, you have access to great care. And by the way, we have some of the best clinicians and we do some of the best research in the world, right? So the U.S. healthcare system is doing quite a bit right. It's not all bad. But we have what's become, and I'll call it a cartel. Nobody's bad necessarily. It's the system that has happened over several decades that has taken the patient further and further away from realizing that their own health, is an asset, and really understanding the implications of healthy living, but also the cost of what healthcare really should be, right? We spent in that same kind of data or that time window, we spent in the U.S. roughly $23 billion in 1960. We spend almost, like I said, over between 3 and 4 trillion today. That's almost a 14,000% increase. That's ridiculous. So what has to change? And while what we think blockchain really has an opportunity to do is kind of reset the incentive structure, right? And really put the patient closer to their provider, closer to what maybe the true cost of prescription drugs should be through something like what Phil's creating, which is a health sharing model, cash pay model. Those are the true opportunities, right? And so the transparency and the incentives can be, if you're thinking about the full potential of blockchain, the incentive structures can be drastically changed to save, trillions of dollars, we believe, over time, not just in the U.S., but globally, by kind of setting, kind of a better stage for behavior and for cost transparency. So we think those are two areas where we think blockchain has a tremendous opportunity to make significant change.
Fantastic. And Phil, if I could just bring you back in a moment, can you just set the scene a little bit and tell me more about the Good Shepherd Pharmacy and the challenges that you actually face and what you hope to accomplish with this partnership? Well,
Good Shepherd Pharmacy, to kind of harken back to what Stuart just said, was the business is built on the soapbox, if you will, that we will not work with insurance. And so we don't accept prescription insurance. Our members may have prescription insurance, but we're not going to bill it. We're not registered with Medicare as a pharmacy that can bill Medicare. I would argue that most pharmacists, most people in my profession would think that it's not possible to have a pharmacy that doesn't accept insurance, that isn't financially founded on insurance reimbursement. And we've proven here with low-income uninsured folks that you can do it and that you can do it and be financially self-sustainable. When working out now, it's a completely different business model for pharmacy in a lot of different ways, and what those look like, where the different opportunities lie, and what our new model of community pharmacy ultimately is going to look like. It's definitely going to include blockchain, and we're documenting everything that we're doing in order to have a repeatable system so that ultimately we'd like to have a Good Shepherd Pharmacy, at least one in every state in the country.
And also, Phil, I believe you and Good Shepherd Pharmacy were featured on NBC Nightly News recently. Can you just tell me a little bit about that?
That was, yeah, our soapbox about prescription pricing and insurance reimbursement. Yeah, they were doing a story. Pfizer raised their prices yet again, and they wanted my opinion on it, and they got it. And it was really pretty, which is, I'll tell you, like prescription price increases kill people. That's really, if I would invite anyone who wants to challenge me on that to come work with me for a week. And they'll see more than one case of a person who doesn't have insurance, who can't afford their medicine. And they'll also see cases of people that are of what would be, relatively high income, fully insured, who still can't afford their medicine. We learned about a patient last week, a gentleman that didn't get his chemotherapy, fully insured, has cancer. There's a cure for his cancer. It was going to cost him $9,000 a month, and he didn't have it, and so he didn't get it. And that's just a time bomb waiting to happen. So yeah, when they reached out, I don't think they expected the curt answer that they got from me about pricing, but it was still flattering to be recognized as a thought leader, at least in that space, and to get to speak up for people that are underinsured, which is a very large growing population in our country. It seems that $5,000 deductible is the new norm as it comes to health insurance, and actually the people with high deductible insurance are our fastest growing patient population. But yeah, so yeah, to answer your question about NBC, that was kind of what happened last week.
Fantastic. And it's great to get your message delivered far and wide through that kind of coverage as well. Now, the two of you recently announced a partnership. So can you tell me a little bit more about that partnership and what it means both to Solaster and also Good Shepherd?
Yeah, so again, carrying out one of the core missions of Solaster is to create an interoperable health ecosystem. And so what that means is, Neil, there's going to be projects that are building on our standard, projects that we support either through technical support, financial support. We'll most likely fund multiple projects that come on to Solaster to build the ecosystem out. But Good Shepherd represented what we felt like was a real business, right, first and foremost. And in the blockchain world, it's very challenging to find actual businesses and rev models that actually could have a blockchain use case, right? So we felt that what Good Shepherd, what Phil and his team have created, first of all, is kind of a sustainable model, right? That's providing a legitimate service that's saving money for individuals and for the system. So, we have kind of a qualifying metric that we look through about, for the projects that we want to support. And so that met a lot of those conditions. Good Shepherd is Solaster's first DApp partner, first solution. And so kind of if you look beyond, there are other verticals within healthcare. There's personalized genomic medicine. There's clinical trial and market research that we're interested in, using the Internet of Things and wearables in terms of doing health behavior incentive solutions. There's pharma track and trace, which kind of bleeds over to what Phil's doing. We even have some goals to kind of create a health savings account type of solution, right? Where more people are thinking about saving for healthcare, right? Like they would a traditional IRA or a retirement account. So there's all of these different aspects, and Good Shepherd really embodied everything that we felt like Solaster is representing as we build to scale. So that's kind of our part of it, but I'll let Phil, I'm sure he has some other comments on that as well.
Yeah, thank you very much, Stuart. So the partnership, I guess the place I'd have to start, and Stuart mentioned this, is the fact that we actually have a viable business that we can apply blockchain to that might very well be the first financially self-sustainable blockchain business. And what that is our membership pharmacy, because we don't bill insurance, our members are accustomed to paying a monthly membership fee, getting their prescriptions in a certain manner. We sync everything up and we provide excellent customer service. We really set the stage to maybe be the first, well, definitely be the first pharmacy that can transition to blockchain. And so what that may look like, and we're still figuring this out, is there actually the potential for a token or a cryptocurrency. The members on our pharmacy on a blockchain system would own their own data, again, be able to monetize that data. We're already doing our first study with a college of pharmacy to actually document how to monetize the data and get that money back to the patients. We see a huge potential in several different ways to tokenize several different things we're doing. With the chemo donations, there may be some way to incentivize donation for a person to earn tokens by making a donation. We're doing another study with another university where we're looking at incentivizing improved adherence. So using that same token to incentivize people taking their medicine on time or participating in an app that we've developed that's going to track their adherence and then record that data back to the patient's profile, adding to what they can market that can be sold as their own data. And then all the things that Stuart mentioned, so many things can easily be layered on top of this. Once we've transferred these patients over, we can start doing pharmacogenomics. We can sell that directly to the patients. And add that to their profile. We're already doing work with trials and looking at how to monetize that in a way that reimburses the individual patients anonymously. We're doing a study on adherence where we're using an app which is involving, IoT to get that data back to the profile. And then the very first project in the whole thing is the remedy chain, which is just establishing a new chain of custody on the blockchain where drugs can actually check meds into the entire system. So all of that to say, the partnership with Solaster is these are great ideas and maybe a little too visionary. I wouldn't argue with anybody who would say that, but how do you build it? And so we brought on a software development company that's been around for 25 plus years, and we needed some blockchain expertise. Was kind of on the market for that. There are several different options, as everyone knows, with what blockchain to go with, and connecting with the folks at Nashville, which truly is becoming the Silicon Valley of healthcare. And Stuart and just a good relationship with those guys decided this is where we want to kind of stake our claim. We want to work with these guys to build out. They agree with the vision. They also agree with the roadmap, which is maybe a huge vision, but there's a detailed roadmap to decide how we're going to get there. And they're going to work with us to build it out.
So looking forward to 2019, what do you think will be the biggest challenges and opportunities ahead to actually deliver on these goals that you've set for yourselves in this partnership?
What we're contemplating here and what we're planning and aiming for is a new way of doing healthcare, right? So one of the biggest challenges is not just 2019, Neil, it will endure probably well past that, is whether it's here or whether it's in the UK, there are incumbents, right, that have kind of, profited and are profiting and serving, some good needs in the healthcare system. And so when you say decentralized healthcare, that scares the heck out of a lot of people, right? That may, and I'll fall on the sword somewhat. I mean, I, as a healthcare innovator and being part of startups, I kind of participated in that fee for service model where the more services, the more surgeries, the more procedures you do, the more, insurance and Medicare pays the hospital. So, it was, there's that cycle that still exists, right? And although we're trying to transition into more value-based care models where, you get bonus points essentially if you get patients out of the hospital, not in 3 days, but in 1 day, that your OR time is less, that, you have fewer readmittances. I mean, those are kind of a few of the value-based metrics that healthcare is now trying to hold itself to in pockets, but it's still got a ways to go. So I would put Solaster and projects like Good Shepherd as we look to more decentralized, transparent models. Our challenge is doing and showing that things can work in a different way and even more efficiently. And what that may mean, by the way, is that certain incumbents may not be a part of the solution, right? In this new health economy that we're building, and that's got to be okay because innovation is disruptive, and so that has been the way it's been forever, not just in healthcare but other industries, and that will be the case here, and it may take some time, but I would say the incumbents are probably our biggest challenge in really banging the drum in a way where we're showing that, hey, we can do healthcare a different way. And by the way, Neil, let me say this: it is the goal to use healthcare less, not more, right? I mean, this is more of a question around health and really kind of rethinking, again, health as an asset, as a personal asset. And people will begin to see through new user experiences and new user interfaces and new systems like Solaster and Good Shepherd and others, that there's going to be a new set of choices and a user experience that's very intuitive, and that's very, and I'll even say this, that has, kind of game theory built in, and it's kind of where other industries have already gotten to, but healthcare is starting to lean that way, and that's really exciting. So yeah, I'll let Phil add to that.
Yep. So challenges and goals for the first year. The two biggest challenges are going to be just the tech side of actually building everything out as we envision it working. And the second one would be actually transitioning our members to a new platform. What we're learning really quickly is that you should not talk to patients about blockchain. Don't know what it's about. And they don't necessarily need to know about blockchain. They just need to know that their data is secure and ultimately where we're trying to go with it. So actually going through the steps of not just talking about that, but doing those two things in a space where very few people have done very much is really, that's the goal of the next year for sure. Above and beyond that, we've got, we hope to complete a second DApp before the end of next year. And then with an eye on doing a third one in 2020.
Fantastic.
Sorry, Neil, I'm sorry. Let me add to those comments. I mean, Phil makes a good point. Let's take the word blockchain out of the vocabulary for a second. All that consumers, customers, patients, providers want to know is our experience, is our product, yes, as if not more secure, and does it make my life cheaper, faster, better, right? Basic marketing questions. And it doesn't matter what the technology is. It's all about user experience and kind of that interface. And if it doesn't make my life a little more efficient, and it doesn't make my data, even I'll say more secure, then it's probably not going to go very far. It doesn't matter how ingenious the underlying technology might be. So I think that's an important distinction.
So also, Stuart, what other kind of work are you doing to increase adoption and bring new partners on board along with this?
It's a great question. So we recently, over the last, I would say 7 or 8 months, Solaster has been kind of on a tour, if you will. And Neil, I was one of the first passengers on the direct flight from Nashville, Tennessee to Heathrow. So let me throw in that shameless plug. But from London to Boston to LA and a couple other places, talking about really what Solaster is and kind of how we're going to build this out and scale it. And people ask me all the time, well, who's your customer? Is it the patient, the provider? It's like, actually, it's neither right now. It's developers and young projects like Good Shepherd. So if there are any developers out there that are working in health innovation and have a great idea, Solaster could be a great home for you to kind of help accelerate that and get that project off the ground. So yeah, I mean that was a big part of it. I would say the more recent development, and I think it's really going to pay huge dividends, is that Solaster just brought on a business development officer, Nick Aurora, who's just a dynamic young mind in the space, did his undergrad at Johns Hopkins, got his medical degree at Rutgers University, and then got his master's after that in public health policy at Yale University. Nick's been in Silicon Valley for the past 3 or 4 years and really been active in the blockchain space. And we think he's going, and his efforts are really going to help source these new projects and bring more Dapps on board and really show the value proposition that Solaster's bringing to the table. So I'm really excited about Nick joining our team and kind of building out the vision that way.
And back to you, Phil. Fine. I mean, what pharmacy-related projects do you envision with the help of Solaster and blockchain moving forward?
Well, we're planning on 3 projects right now to kind of lay the groundwork to grow into other things such as genomics and other trials. Those 3 fundamental projects, the first one's Remedy Chain, which is essentially a chain of custody DApp on the blockchain to reestablish chain of custody on these expensive meds, but it'll also be chain of custody for every med that we purchase. We'll be checking everything in through that system. A second one is a drug delivery system so that we can maintain actual possession of the drugs from the time they are donated to the time they're put in the patient's hand, and thereby on the blockchain, track that data straight from donation to, if they're on our app, we even know when they take the pills. So all of that data along the way. And the third and probably most robust one is a patient healthcare wallet, which allows, as I said, the patients to own all their own data, and be able to monetize it. Those are the first three things we need to kind of see happen in order. And I could see where people would argue that the wallet needs to come first, but from a functional standpoint, because we're actually running a business, that it's the chain of custody piece that we're working on first. But ultimately setting the stage for a pharmacy ecosystem that Solaster's Go70 protocols are going to allow all these Dapps to kind of communicate and work off the same data set.
Fantastic. Well, a huge thank you to both of you for taking the time to come on today. But before I do let you go, just for anyone listening that wants to find out more information about your partnership, about Solaster or Good Shepherd Pharmacy, what's the best ways of checking you guys out and staying in contact with any future developments?
Sure. You can follow us at solaster.io. And there on our news feed, you can see kind of what the latest news is and around partnerships. There's a couple of articles out there on the Good Shepherd Solaster partnership. So we're pretty easy to find. And obviously, Phil and I have done a few different kind of media and podcast appearances, and certainly his recent story on NBC Nightly News is easily sourced as well. So a lot of ways to follow the project and to really learn more about us.
For me, a good way to kind of check out what we're doing is check out our website. It's Good Shep RX. If you've heard of Good RX, we're Good Shep RX, Shep like shepherd. And then also this first blockchain project, the Remedy Chain project, the website for that is Remedy. It's Remedy with an I, not a Y, remedychain.com. We're posting everything, weekly updates there as well. LinkedIn's a great resource. And then anybody who's interested, my email is phil@remedychain.com. And I would welcome emails from anyone listening.
Well, again, thanks so much to both of you for coming on today. I think on this podcast, I either have someone from a blockchain project or a partner. But to have you both on and to hear how you're both leveraging technology and solving real problems through technology is a real breath of fresh air. So I really do appreciate it. Thanks for coming on today, guys.
Well, thank you very much for having us.
Neil, thanks for having us on.
Wow, what a great conversation. And I think that it worked great hearing both about the solution, Solaster, but also the real problems that it solves, not from the point of the view of the company, but straight from one of their partners. And it seems there is a tech solution for everything out there. And like I said earlier in the show, unless anything has real-world adoption and solves real problems, it doesn't matter. So that's why I really enjoyed this one. But over to you. I mean, what did you take away from today's conversation? I'd love to hear, so please email me techblogwriter@outlook.com, tweet me at Neil C. Hughes, or of course visit my website, techblogwriter.co.uk. If you go to podcasts, you can leave me a voicemail and listen to any of the 700 plus episodes that we now have in our back catalogue. So here's to another great week together and counting down the days to opening door number 1 of our Advent calendars. Do you have one at home? When I was growing up, it used to be just a picture behind there. Then it was chocolate. Now it's things that cost you a small fortune like gin, beer, Jack Daniels, makeup, perfumes, and so much more. So if you do have one, I want to know what you've got, how much you spent, and why you did it, most importantly. So let me know. Email me techblogwriter@outlook.com, but it's time for me to go now. So I'll report back tomorrow, I promise you that. So thanks for listening, and until next time, don't be a stranger.
Thanks for listening to the Tech Blog Writer Podcast. Until next time, remember, technology is best when it brings people together.